Have you ever walked into a room and forgotten why you were there? Misplaced your keys? Forgotten someone's name for a moment? Most of us have, and usually it's completely normal. But what if certain small changes begin happening more often? What if they slowly start affecting everyday life without anyone realizing what's really going on? Dementia rarely begins with dramatic memory loss. In many cases, it starts with subtle changes that families dismiss as stress, aging, or simple forgetfulness. By the time the symptoms become obvious, valuable time may have already been lost. Doctors say that recognizing these early changes doesn't mean someone definitely has dementia, but it can be the first step toward getting proper medical evaluation, identifying treatable conditions, and planning ahead. Today, we'll walk through 9 early changes that can be associated with dementia, explain why they happen, and discuss what families should know. Some of these signs may surprise you because they often have little to do with memory itself. Stay with us until the end because the final sign is one that many families overlook completely, even though it can appear years before a diagnosis. Dementia is not a single disease. It is a general term used to describe a group of conditions that affect memory, thinking, reasoning, behavior, and the ability to perform everyday activities. Alzheimer's disease is the most common cause, but there are many others, including vascular dementia, Lewy body dementia, and frontotemporal dementia. While age is the biggest risk factor, dementia is not considered a normal part of aging. Many older adults remain mentally sharp well into their 90s. The difference lies in whether changes interfere with daily life and continue to worsen over time. Doctors emphasize that early evaluation is important because some conditions that resemble dementia, such as vitamin deficiencies, thyroid disorders, infections, medication side effects, depression, or sleep disorders, may actually be reversible with proper treatment. The first early change is increasing difficulty with short-term memory. This is often the symptom people think of first, but early dementia is not simply forgetting occasional details. Instead, someone may repeatedly ask the same question within minutes because they don't remember receiving the answer. They may forget recent conversations while recalling events from decades ago in vivid detail. They might miss appointments even after writing them down, or forget why they entered a room over and over again. Families sometimes become frustrated, believing their loved one simply isn't paying attention. In reality, the brain may be struggling to create new memories. Doctors explain that memory formation involves several brain regions working together, and in many types of dementia, these pathways begin to weaken. It's the repeated pattern, rather than isolated incidents, that deserves attention. The second change involves problems planning or solving everyday tasks. Someone who once managed household finances without difficulty may suddenly struggle to balance a checkbook or pay bills correctly. Following a familiar recipe can become confusing. Even organizing a grocery shopping trip may feel overwhelming. Activities that require multiple steps become harder because the brain has difficulty processing information efficiently. A person may start avoiding tasks they once enjoyed because they quietly recognize something has changed, even if they can't explain why. Family members may mistakenly assume they have become lazy or distracted, when in reality, their thinking processes have become slower and less organized. The third early change is becoming confused about time or place. A person may lose track of the day of the week, forget what season it is, or become uncertain about where they are despite being somewhere familiar. They might wake from an afternoon nap convinced it's morning, or become disoriented while driving a route they've traveled for years. Sometimes they eventually remember after a few moments, but other times the confusion persists. This happens because dementia can affect areas of the brain responsible for orientation and spatial awareness. These episodes are more significant than occasionally forgetting today's date. The concern grows when the confusion becomes frequent or interferes with daily life. The fourth change is difficulty finding the right words during conversations. Everyone occasionally struggles to remember a specific word, but dementia-related language changes tend to be more noticeable. Someone may stop in the middle of a sentence because they cannot continue. They may replace familiar words with unusual descriptions, calling a watch the hand clock, or referring to a refrigerator as the cold cabinet. Conversations may become repetitive because they forget what they've already said. They may also struggle to follow discussions involving several people at once. Families often notice these language difficulties before the individual does. Doctors say language problems can appear early, especially in certain forms of dementia, making communication increasingly challenging over time. The fifth change is withdrawing from hobbies, social activities, or family gatherings. A person who once loved attending community events, playing cards, gardening, or spending time with friends may slowly begin making excuses to stay home. This isn't always due to sadness or lack of interest. Sometimes social situations become stressful because following conversations, remembering names, or keeping track of events becomes more difficult. Rather than risk embarrassment, many people quietly withdraw. Family members may think they're simply becoming less social with age, but doctors encourage paying attention when this withdrawal is unusual for that person's personality and continues over time. The sixth early change involves changes in judgment and decision-making. Someone may become unusually trusting of strangers, fall for phone scams, spend large amounts of money impulsively, or neglect personal hygiene despite previously taking pride in their appearance. They might wear heavy winter clothing on a hot summer day or fail to recognize spoiled food in the refrigerator. These changes can create serious safety concerns. Judgment depends on complex brain functions that help us evaluate situations, recognize risks, and make appropriate decisions. As these areas become affected, poor decisions may become increasingly common, sometimes before severe memory problems appear. The seventh change is noticeable changes in mood and personality. Family members often describe their loved one as seeming like a different person. Someone who was calm and patient may become irritable or easily frustrated. A naturally outgoing person may become unusually quiet or suspicious. Others may develop anxiety, depression, fearfulness, or emotional outbursts that seem out of character. Doctors explain that changes within the brain can directly affect emotional regulation. In addition, individuals may feel frightened by the confusing experiences they're having, but cannot fully understand or express what they're feeling. This combination can lead to significant personality changes that families find difficult to understand. The eighth change is trouble with visual perception and spatial awareness. This symptom is often overlooked because many people assume vision problems are simply related to aging eyes. However, the eyes themselves may be perfectly healthy, while the brain struggles to interpret what they see. Someone may have difficulty judging distances, stepping off curbs, recognizing faces immediately, parking a car, or identifying objects in low lighting. They may become more prone to falls because they misjudge steps or obstacles. Reading can also become harder because lines of text seem confusing even when eyesight tests remain normal. Doctors stress that visual processing involves the brain just as much as the eyes, making these changes important to recognize. The ninth and final early change is losing initiative and becoming less engaged with everyday life. A person who once eagerly started projects may spend hours sitting quietly without doing much at all. They may need repeated reminders to begin simple tasks like getting dressed, preparing breakfast, or taking medications. Family members sometimes interpret this as stubbornness or laziness, but doctors explain that changes affecting motivation and executive function can make it genuinely difficult for someone to initiate activities. The desire to participate may still exist, but turning that intention into action becomes increasingly challenging. This subtle shift often develops gradually, making it easy for families to overlook until they realize just how much has changed. It's important to remember that having one or even several of these changes does not automatically mean someone has dementia. Many medical conditions can produce similar symptoms. Depression can cause memory difficulties and poor concentration. Certain medications may create confusion. Hearing loss can make conversations difficult, leading people to appear forgetful when they simply didn't hear information clearly. Poor sleep, dehydration, infections, uncontrolled diabetes, thyroid disorders, vitamin B12 deficiency, and even severe stress can all affect thinking and memory. That's why doctors encourage a thorough medical evaluation whenever these symptoms become persistent or begin interfering with daily life. Families play a critical role in recognizing early changes because individuals experiencing dementia may not always notice the progression themselves. Keeping track of specific examples can be helpful during medical appointments. Instead of saying, "Mom seems forgetful," it's more useful to describe situations like repeating the same question several times in one afternoon, forgetting scheduled appointments despite reminders, or becoming lost while driving familiar routes. Concrete examples help healthcare providers better understand what is happening and determine which evaluations may be appropriate. Receiving an evaluation does not automatically mean a diagnosis of dementia. Doctors may perform physical examinations, memory testing, neurological assessments, blood work, brain imaging, and medication reviews. These steps help identify possible causes and determine whether symptoms are related to dementia or another medical condition. Even when dementia is diagnosed, early recognition allows families to access treatments that may help manage symptoms, participate in planning, improve safety, and connect with valuable support services sooner rather than later. Supporting someone with early dementia requires patience, understanding, and compassion. Arguing over forgotten details rarely helps and often increases frustration. Clear communication, simple routines, written reminders, labeled household items, and a calm environment can make daily life easier. Most importantly, remember that the behaviors you're seeing are usually symptoms of changes within the brain rather than intentional actions. Responding with empathy instead of criticism can significantly improve quality of life for both the individual and their family. Research into dementia continues to advance, and scientists are learning more every year about early detection, risk reduction, and potential treatments. While no single lifestyle choice can completely prevent dementia, maintaining physical activity, managing blood pressure and diabetes, eating a balanced diet, staying socially engaged, getting adequate sleep, protecting hearing, avoiding smoking, and keeping the brain mentally active are all associated with better overall brain health. These habits support healthy aging, regardless of whether someone develops dementia later in life. The most important message to remember is that early changes deserve attention, not fear. Recognizing these signs does not mean assuming the worst. Instead, it means taking concerns seriously enough to seek professional medical advice. Whether the cause turns out to be dementia or another treatable condition, early action provides the greatest opportunity for the best possible outcome. If you found this video helpful, take a moment to share it with your family and friends, because recognizing these early changes could make a meaningful difference in someone's life. Leave a comment below letting us know which of these signs surprised you the most, and don't forget to subscribe to the channel for more trusted health information designed to help you and your loved ones stay informed, stay healthy, and age with confidence. Thank you for watching, and we'll see you in the next video.